Okay, so let's continue our module 2, which is about interpreting 12-lead ECG. So far we have finished rate and rhythm, these two steps. Now we are on the third step, which is about the axis. So step 3 is axis determination. So here in this step we are going to learn y-axis determination, different axis quadrants, axis determination, and in the end we will practice some ECG strips. So why we check the axis? So determination of the axis is extremely helpful in the diagnosis of conduction defects, the hemiblocks. The single most important reason to assess the axis is to identify the presence of hemiblocks. Then the axis can also be disturbed in other conditions like ventricular enlargements, broad complex tachycardias, congenital heart diseases, WPW syndromes, and pulmonary embolism, and so on. So what's axis? We have seen in the module 1 that the electrical forces originates or starts from the right upper and move towards the left lower direction. So they come in different direction. The summation of electrical current generated by the ventricular depolarization is called mean QRS vector, and this direction of the mean QRS vector determines the axis, or in simple words, the QRS vector is axis. If we draw an imaginary line around the imaginary circle around the heart, so left side is at 0 and right side is 180, top is minus 90 and bottom is plus 90. So the normal QRS vector falls between 0 to plus 90. And this is our normal axis. But axis can be in other quadrants as well. So as I said, the normal axis or the normal vector falls between 0 and plus 90. This is left lower quadrant. The axis may fall between 0 and minus 90, left upper quadrant. If the QRS vector falls between 0 and minus 90, it's left axis deviation. Another quadrant is between plus 90 and 180 is the right lower quadrant. If the vector falls between plus 90 and 180, that's called the right axis deviation. And if the vector falls in the right upper quadrant between, that is minus 90 till 180, the axis is called extreme right axis deviation. Now you have this ECG. Which leads you are going to assess the axis? Lead 1 and AVF. So why lead 1 and AVF? Because they're perpendicular to each other, and let's review the lead 1 first. Lead 1 is bipolar. It has two poles, right arm and left arm. Right arm is always negative and left arm is always positive. So any direction of current towards left arm shall produce the positive QRS complexes. So lead 1 is oriented at 0. So any wave of depolarization directed towards it will result in positive QRS complexes because the positive electrode is in front of the vector of the current. So but what happens, there is a range which lead 1 covers from minus 90 till plus 90. Though the vector is oriented at the 0, but if you see the range of lead 1, so it means the vector for the lead 1 can fall anywhere between minus 90 till plus 90 and it will be positive, but normally it's oriented at 0. Now let's see the lead AVF. AVF is a unipolar lead and positive electrode is at the left leg. So any vector of the current towards it again will produce the positive complexes. So again, lead AVF is oriented at plus 90 degree. A wave of depolarization towards it will result in positive Cuirass axis. And as I said, although it's oriented at plus 90, but it covers from the area from 0 till 180. So any mean Cuirass vector between 0 and plus 180 will be positive. If you combine these two leads, the area covered or overlapped by these two leads is between 0 to 90. So if the Cuirass vector falls between 0 and 90, it's called normal axis and both lead 1 and AVF will be positive. So in summary, if the Cuirass complex is positive in both lead 1 and AVF, the Cuirass axis must be between 0 and plus 90, because this is the area where lead 1 and AVF overlap, and as a result the axis must be normal. So if on the ECG, if you see both 1 and AVF positive, thumbs up, this is your normal axis. Now let's see how to determine the axis. In case of normal axis, both lead 1 and AVF should be positive. For left axis deviation, lead 1 will be positive and AVF negative. For right axis deviation, lead 1 will be negative and AVF will be positive. In case of extreme right axis deviation, both lead 1 and AVF shall be negative. Let's see what happens to the axis according to the shapes and direction of the Cuirass complexes. If both 1 and AVF, both complexes are positive, the axis is normal as we have discussed. But what happens if lead 1 is positive and AVF is negative? If the 1 is positive, it means mean Cuirass vector is towards 0. But if in case of AVF, the mean Cuirass vector will not be towards positive electrode, but it moves its direction away from the positive electrode towards minus 90. So the area overlapped will be between 0 and minus 90, and that's called left axis deviation if the vector falls between 0 to minus 90. If the lead 1 is negative and AVF is positive, what happens? Let's see. Okay, if the 1 is negative, the Cuirass vector changes its direction from 0 towards 180. As it changes its direction, so the direction of the electricity or direction of the Cuirass vector is away from the positive electrode, so you will get the negative Cuirass complexes. But if in case of AVF, the Cuirass vector will move towards the positive electrode, which is at the plus 90 area. So the area overlapped by these two leads will be between the plus 90 and 180. If the Cuirass vector falls between the plus 90 and 180, it's called right axis deviation. If both 1 and AVF are negative, it means the Cuirass vectors have change their direction away from the positive electrodes, and the area overlapped will be between -90 and 180, and if the vector falls between -90 and 180, it's called extreme right axis deviation. So we'll apply a few steps to determine the axis. The step 1 is determine Curis complex is in lead 1 is mostly positive or negative. Step 2, determine Curis in the lead AVF is mostly positive or negative, and then check the axis. If lead 1 is positive mostly and AVF is positive mostly as well, the axis shall be normal. If the 1 is positive, AVF is negative, it's left axis deviation. If 1 is negative and AVF is positive, right axis deviation. If both are negative, extreme right axis deviation. Let's practice. Okay, this is the ECG. Obviously, you are going to look for the lead 1 and AVF. If both are positive, what will be your axis? Normal axis. If 1 is positive and AVF is negative, yes, left axis deviation. If 1 is negative and AVF is positive, right axis deviation. If 1 is negative and AVF is also negative, means both are negative, the axis shall be extreme right axis. Look at this ECG and try to determine the axis. Look at the lead 1, and if you draw a line here, you will see 50% is positive and 50% of the Curis complex is negative. So it's very difficult that is it a positive complex or a negative complex. Similarly, if you look at the AVF, 50% is above the isoelectric line and 50% is below the isoelectric line. So here it's very difficult to determine the axis. So this is called equiphasic or biphasic complexes, and you can't comment on axis in this ECG. Now, one of the variety of the axis, that's the left axis deviation. It's very important to focus a bit more on the left axis deviation. So first step is you have to look, do I have left axis deviation? If the answer is yes, then look at the lead 2. If the Curis complex is negative in the lead 2, then this left axis deviation is pathological. So what it means, left axis deviation can be a normal finding, can be a part of the normal ECGs or some other ECGs. But if the Curis complexes in lead 2 are negative in presence of left axis deviation, it's pathological and it's very significant clinically. We'll discuss in detail in Hemi blocks. So look at this ECG. Is there any left axis deviation? Answer is yes. 1 is positive and AVF is negative. This is the left axis deviation. Now this second step is look at the lead 2. If it's positive or negative. If it's negative, like in this example, it's pathological left axis deviation and it's clinically significant. If the patient presents with some chest discomfort and chest pain, and you will get this ECG, so just be cautious and just get second opinion, and we'll talk in detail in the Hemi blocks. Look at this ECG. Is there any axis deviation? Yes, there's left axis deviation. Now look at the lead 2. Is it positive or negative? This is positive. So this left axis deviation may be physiological, as there is evidence of left ventricular hypertrophy on this ECG. It may be a part of left ventricular hypertrophy. So in summary, as far as the axis is concerned, if the QRS vector falls between 0 and plus 90 on the ECG, you will get lead 1 positive as well as the lead AVF is positive, and it's called normal axis. If the QRS vector falls between 0 and minus 90, the lead 1 will be positive and AVF shall be negative, and the axis is left axis deviation. If the QRS vector falls between plus 90 and 180, the lead 1 shall be negative and AVF will be positive, and the resultant axis deviation is called right axis deviation. If the QRS vector falls between minus 90 and 180, both lead 1 and lead AVF shall be negative, and it's called extreme right axis deviation. Thank you very much.